In this video, we will gain a broad understanding of the role of diet in weight loss. In particular, we will learn how to diagnose being overweight or obese, how do you calculate the calories, and how these relate to certain diets, the initial assessment for losing weight, and the initial measures that are prescribed for anyone who's attempting weight loss, and then the types and the details of the various diet regimes. The commonest measure for obesity is the body mass index, also called the BMI. So in this figure, the weight is first measured in kilograms and the height in meters, and the weight is divided by meters squared to get a measure. 18.5 to 25 is normal, and then anything above that moves a person from being overweight to obesity, where a BMI of greater than 40 is severe obesity. Associated with obesity are certain complications that significantly increase the risk, and being obese means that they are much more likely to happen and impact the quality of life as well as longevity. So the commonest being type 2 diabetes, cardiovascular disease such as coronary vessel disease or hypertension, sleep apnea, dyslipidemia such as high cholesterol, or problems with triglyceride or low density lipoproteins, degenerative joint disease such as arthritis, and psychological problems associated with being obese. We also need to understand that the food we eat is finally converted into energy by the body, and then our bodies also expend energy, and this is also impacted by our physical activity. We need to have a broad understanding of what are called the basic building blocks of nutrition. They're called the macronutrients, which are highlighted in the pie chart over here. The bigger part that we take daily, and which is the main source of our energy, are the carbohydrates, and then the proteins, and finally the fats. Fiber and water make up other important components. So here's a broad flow chart of what is recommended according to BMI, 18 to 25, yearly surveillance, and an overview of weight gain. Those who are 25 to 30 but without any of the comorbidity that outlined before, general recommendation on a healthy lifestyle and an exercise program and help with monitoring. Those who are 27 to 30 but with a comorbidity such as hypertension, cardiac disease, type 2 diabetes, etc., then a highly comprehensive lifestyle change is required, as well as medication therapy if indicated. Finally, those who are greater than BMI of 40 or greater than 35 with any of the comorbidity, then offer to referral to a surgeon for weight loss surgery sometimes might be appropriate. So this is very broad categorization. Our main measure of understanding how much energy we are taking is through the calories. This is a busy slide. For those interested, they can pause it, but I will explain it very broadly. We need a basic understanding of how many calories does each person burn when they are not undertaking any activity, and the other is have a broad understanding of how much activity is a person undertaking, and then we multiply the two to get an understanding of the total energy expenditure in calories for each person. Once we have a definite number from this, we can determine for each person what kind of dietary requirements a person may take during the day to achieve weight loss. Another way of understanding is that for each kilogram of weight, our body needs about 22 kilocalories. So for a 100 kilogram woman, the daily requirements would be 2,200 calories. Hence, a diet that is in deficit of 500 calories for this person will produce half a kilogram of weight loss per week, or around 1 pound per week. The effect will stabilize as this person loses weight over a 3 to 6 month period. Continuing a 500 calorie deficit will not produce any further weight loss after this period, as the body becomes used to a stable intake of energy and after the initial weight loss. So for any further weight loss, a further calculation will be required and a further reduction in the amount of calories. There of course will be an effect of increased activity that certainly will speed up weight loss and decrease obesity. Hence, physical activity and taking lower calories is the most effective way of weight loss. Prior to commencing any diet, it is absolutely important that the person is screened for diagnoses such as eating disorders, whether or not there is binge or nighttime eating, the person's emotional well-being, anxiety, depression, and other mental health issues that might be an impediment in motivation or weight loss. For each person to try and determine the best diet, an understanding of current dietary habits, such as over here, is required. 24-hour or 3-day diet recall about what that person has had, the meal timing, snacking habits and triggers for eating, food preferences, allergies, use of supplements, and the previous attempts at weight loss and their outcome. Every person who is overweight is given initial advice regardless of the kind of diet. The first is to eliminate all caloric beverages, cold drinks, whether they are alcoholic or non-alcoholic, because these are one of the commonest source of unwanted calories. And the other important advice is to reduce processed foods as much as possible. Alcohol intake ought to be moderated, a clear concept of portion control, a measure of self-monitoring to know how much energy one is consuming, and finally help in adopting a healthy long-term approach to eating. Broadly, the diets fall into these categories: balanced low-calorie diets, low-fat diets, low-carbohydrate and low glycemic index diets, high-protein diets, the very low-caloric diets, intermittent fasting, which is gaining popularity, and then a word of caution about fads and celebrity diets, because these do not usually fit any of the dieting patterns for which we have a fair amount of research now and are unlikely to produce long-term or sustained good results. Now let's look at each of these individual diets. The first is the balanced low-calorie diet. What it means is that you have all of the macronutrients in normal proportions as well as vitamins and minerals. However, the amount is controlled. So there are two main strategies. One is called the portion control diet, and as the name suggests, calorie specific portions are pre-cooked or prepared from 200 to 500 calorie portions, which are then stored and taken as required. Now the advantages are that it removes multiple decision making, what you might eat, and it simplifies choice, and it accurately records how much calories a person might have had over the course of the day. This could be food packets or liquidized versions of this. Apart from the portion control, the next one is called the low-calorie healthy diet. There are two specific ones. One is called the Mediterranean diet and the other is DASH. The Mediterranean diet, the monounsaturated fat, which is the good kind of fat to have, high consumption of vegetable fruits, legumes, nuts, grains, moderate consumption of milk and dairy products, mostly in the form of cheese, and relatively low intake of meat, as well as moderate alcohol intake in terms of red wine. This diet is associated with maintaining weight and a reduced incidence of complications and cancers. More recently, a further diet developed to maintaining blood pressure or hypertension is called the DASH diet. 4 to 5 servings of fruit, 4 servings of vegetables, and 2 to 3 servings of low-fat dairy are taken per day, and the amount of fat is less than 25% of the total dietary caloric requirement. So the next one is the low-fat diet. In this pie diagram, you can see the fats outlined over here, and this proportion is reduced further as a total caloric intake. So it's less than 30% and certainly at times up to 20%. And this is replaced by healthy carbohydrates such as vegetables, legumes, nuts, etc. And this diet is associated with maintaining a good healthy weight. And one way of knowing whether or not you are taking fat is if the food melts in your mouth, then it's likely to be fat. And rather than calculating calories, one calculates the grams of fat, and each gram of fat is around 9 calories. It is very helpful to have a dietitian sit with you and plan a diet for you. And if it is self-directed, then one should aim for no more than 45 grams of fat and a total dietary intake of 1500 kilocalories. But again, that is dependent on the weight and the goals of weight loss. Proteins are the building blocks of tissue. A high protein diet has been recommended. However, when combined with low fat or high fat diet over a 3-month period, there wasn't much difference in weight loss. Generally, a greater than 20% intake of protein is required. So in this portion, the amount of protein taken would be more than usual. Proteins are more filling and they produce heat. I will discuss them again in the context of low carbohydrate diets, where they are associated with maintaining weight long term. The diets that are popular at the moment are some version of the low carbohydrate diet, and there are two main versions. One is the low carbohydrate, where the daily intake of carbohydrates is between 30 to 60 grams, and the other is the very low high carbohydrate diet, where it does not exceed 45 grams, but in most cases does not exceed 30 grams. In this pie chart, you can see a large portion of carbohydrates, and this is reduced significantly, and these portions are then taken up by more protein and fat according to the diet undertaken. It is postulated that the current obesity epidemic is because of excess of the wrong kind of carbohydrates, such as sugary drinks and a high intake of carbohydrates that are easily broken down into glucose, thus causing deposition of excess fat. These kinds of diets tend to have good short-term outcomes. However, over the long term, such as over a year or so, when compared to portion control diets, the outcomes are not that different. The proposed carbohydrate substitutes generally in these diets are either protein or fat or both. And finally, the proposed kinds of food taken are usually derived on glycemic index. The glycemic index indicates how quickly a certain kind of food causes a spike of blood glucose levels. A very steep spike means that the foods have a high glycemic index, whereas a slow rise means a low glycemic index. I would specifically like to mention two kinds of diets based on the low carbohydrate diet. One is the ketogenic diet and the other is the Atkins diet, which are similar but with specific differences. The ketogenic diet is the very low carbohydrate diet with increased fat, what is termed as the healthy fat, as a bigger proportion, as well as protein, to the point that most of the energy is then derived from fats in a process called ketosis. This kind of diet is in general recommended for more rapid weight loss. The Atkins diet, at least initially, starts out as very low carbohydrate diet, but then for the remaining period, the amount of carbohydrate may change over time, and in proportion the portion of protein and fats is increased, and trials have shown good outcomes with the Atkins diet, where the weight loss once initiated was maintained at a year or longer. It's also important to mention the very low calorie diet, which is between 200 to 800 calories, often referred to as crash diets, versus a starvation diet, which is less than 200 calories a day. Research has not shown any significant benefit for either of these, and over the long term, these may be associated with health effects such as thinning of hair, thinning of skin, and loss of lean muscle mass. So in general, they may have some value in people who want to lose weight very quickly for a specific purpose, but over the long term, they're generally not recommended. Apart from the keto diet, there is a lot of lay interest in intermittent fasting, also called time-restricted fasting, so that over a 24-hour period, a significant proportion means no caloric intake or just taking coffee without milk. This is in general associated with an improvement in insulin sensitivity, weight loss. It may have anti-inflammatory process and may reduce the deposition of atherosclerotic plaques in the blood vessels. In general, it's thought that the intermittent fasting sets into motion a primitive reflex which resets the body's metabolic clock so that increasingly more fat is utilized for burning the energy. There are two main principles. One is called the 5-2 principle. A person may take normal diet for 5 days, but then for 2 non-consecutive days, no more than 400 to 500 calories are taken. And in the other version of time-restricted fasting, eating is only limited to between 4 to 8 hour periods depending on individual requirements, and these could be in the morning or evening, where a prolonged period of fasting leads to a period of eating that is not then restricted. It is important that for each person, individualized plan is made based on individual preference, motivation, activity levels, because this is something that one would have to behold over the long term to achieve the best results. And with like anything else, diet alone is not going to be the answer. It has to be multimodality with a change in behavior aimed at healthy living. This concludes this presentation. If you have any questions, please do share.